Namaste, Dr. Hridhya here. Hope you are all aware that the first week of August annually is commemorated as World Breastfeeding Awareness Week. The main aim of this program is to protect, promote and support breastfeeding. It is not a social stigma but a requirement which actually helps the baby physically and mentally. Breastfeeding is very crucial for mom-baby bonding and also to maintain their health and well-being. The benefits of breastfeeding is multidimensional. For the babies, it provides with appropriate nutrients and antibodies which can protect them from getting with the common childhood diseases or the newborn diseases like diarrhea, pneumonia, ear infections, etc. It also improves the immunity power of the baby. And for the mom, it has different health benefits. It protects her from future ovarian cancer and breast cancer. It is also a very effective method of contraceptive, giving 98% efficacy during the first 6 months after birth. Breastfeeding has long-term benefits too. Kids who were breastfed are less likely to develop overweight, obesity and type 2 diabetes in future. And it has been observed that kids who were breastfed are having a high IQ levels. Having said the importance of breastfeeding, now I can share with you some important frequently asked doubts regarding breastfeeding. The first one is what is exclusive breastfeeding and how long it should be continued. Exclusive breastfeeding means feeding the baby only with breast milk. That is, it can be directly from the breast itself or it can be an express breast milk other than the normal syrups and medicines prescribed by the pediatrician. Exclusive breastfeeding is very important for the development of the baby. Actually, breast milk contains optimal nutrients like proteins, carbohydrates, fats, etc., which is required for a healthy development of the baby. Exclusive breastfeeding is very important for the normal growth and development of the baby. Breast milk contains optimal proteins, carbohydrates, fats, which is very important for the baby's growth. The whey protein in the breast milk actually is very easily digestible for the baby's gut. It also contains DNA, DHAs as well as amino acids, which is very important for the retinal development and brain development in babies. Exclusive breastfeeding can be continued until 6 months according to ancient science of Ayurveda as well as the most recent studies. After 6 months, gradually introducing of solid food can be done and breastfeeding can be continued until 2 years of the baby. Another important question which is asked is when to start breastfeeding and how to initiate breastfeeding. Breastfeeding should be started within 1 hour post-delivery. Whether it can be cesarean section or normal delivery, immediately latching the baby is very important to the mother. The breastfeeding can be effectively initiated if the mother is properly educated regarding breastfeeding and also by the support of the family members. Very patient as well as understanding family member is also important. Without giving any kind of blame or stress to the mom is required for initiating the breastfeeding. The blaming game, victimizing the mom for not breastfeeding can actually give a very negative impact on breast milk production. Another question is the positions for breastfeeding. There are different positions mentioned like cradle hold, cross cradle hold, football position, clutch hold, like that. This which can be adopted, the positions can be adopted according to the mother's and baby's convenience. Now recently the breastfeeding pillows are available to make this job much easy. Another question which is frequently asked is how many feeds per day? In an average 10 feed per day is optimal. Another major doubt is how many feeds daily is required for the baby and how to ensure that the baby is growing adequately. In an average, 10 breastfeedings per day considered well and good for the baby's growth. The session should last for 15 to 20 minutes and in a gap of 2 to 3 hours. How we can ensure that the baby is adequately having her breastfeeding is we should ensure that the baby passes the urine within 8 to 10 times per day, sleeping for almost 1 to 1.5 hours after every feed, and the baby is growing in weight gain almost 20 to 30 grams per day. Regarding the growth of the baby, or considering the growth of the baby, there should be a length of 3.5 centimeter every month, and the head circumference should grow 2.5 centimeter on a monthly basis. The attainment of development milestones is also a good sign of ensuring that the baby is fed well and good. Coming on to the challenges of breastfeeding. The new mother faces a lot of challenges when she starts first time feeding her baby. The most common challenge happens when the baby is premature. Premature babies find it very hard to latch with the mother's breast. Another problem which the mom faces is having a sore breast, cracked nipple, inverted nipple. So these kind of difficulties makes the mother actually have a negative impact on feeding. So healing it on right time and helping the mother properly can help easy milk production as well as better breastfeeding in future days. New moms will be exhausted from the labor pain as well as sleeplessness. So victimizing and blaming the mom for not feeding her baby again creates a situation to worsen up. Better to support, good support from the spouse and family members with good compassionate approach can actually enable to improve her confidence level, thereby helping her to feed her baby properly. So this is an important aspect. Instead of blaming the mother, actually sit with her, talk with her and give her more confidence, which can actually help her to nurture her baby in future days. Now we are coming across a lot of women who is having a work as well as life balance. So moms who are working can actually help the babies with the appropriate supply of breast milk through express breast milk method, that is by pumping breast milk and giving the baby on a timely basis. You can actually get a good breast pump and express the breast milk out and just feed the babies every 2 to 3 hours. The express breast milk can be stored outside in room temperature for 4 hours, and if it is kept inside the fridge, it can be maintained till 6 hours to 12 hours. And if it is frozen or if it is inside the freezer, then the breast milk can be stored for 6 months also. So appropriate usages of gadgets also can benefit the baby with the breast milk in these recent times of job and all these work times. Breastfeeding is the strongest foundation for the healthy life of the baby as well as the mom. But as this is a breastfeeding awareness week, we have mentioned some importance of breastfeeding. But if you due to some or the other reasons, if you are unable to breastfeed also, don't worry. There are many other supportive measures which can help for the healthy development of the baby in your life. So if at all you are facing such kind of problems in breastfeeding, or you find difficulty in handling your baby, feel free to contact us. Thank you.